This
program in
conference will
Manorama
now be
channel
recorded.
and is a member of Ayurveda special team in 2010 Commonwealth Games in New Delhi. It is a pleasure to have you with us, sir, today.
Thank you, Hridaya. Am I audible?
Yes, sir, you're audible.
Okay.
Before
So I
we
can.
begin, I call upon Seena. Yes, sir.
Okay,
So
okay,
we'll start with a prayer.
okay.
Yes, sir. I call upon Seena for the prayer.
रागादिरोगान् सततानुशक्तान् अशेषकाय प्रसृतानशेषान् औत्सुक्यमोहारदतितान् जगानान् यो पूर्ववैद्याय नमोऽस्तु तस्मै.
Without much delay, we shall start this session. Over to you, sir.
Thank you, Hridaya. Am I audible?
Yes, sir, you're audible.
Yes. And visible also. Hope so.
Yes, sir, visible. You can now present your screen.
Okay. First of all, 1 second. Share my screen.
Yes, sir, it's visible.
Okay, it's visible. So can we start?
Yes,
Hello.
sir. Yes, sir, sure. We can start.
Okay. So first of all, thanks for calling me in the HSA's this session. Actually, it's a not common common presentation. It's a topic of medical legal is not usually taken. Actually, I think 3 years back I have taken to one batch of house surgeons. That is during their finishing time. Usually, actually, the specialty of this topic is, or the importance of the topic is, more than while we studying, actually we are studying the forensic and medical jurisprudence and all those things in the 3rd year, or I think your batch in 2nd year. But the use of this comes when you go to the practice. So it is very important that each and every aspect of this medical legal parts should be known to you. Why? Because I and my department colleagues will get lot of calls regarding the doubts when someone is in problem or some doctor is in problem. It is from our college, and it's from our co-faculties, and even and from students also. Actually, last week I want to tell you one incident. 2 weeks back in our hospital itself, I'm working in Government Ayurveda College. Everyone, I think everyone in this group knew. And in our Panchakarma hospital, one patient came with a complaint of backache, low backache or kadigraham. And our diagnosis is kadigraham, and he was on way of during management. This patient told actually he wants an extended treatment because he don't because his pain is reducing, not reducing like that, but actually as per symptoms it is reducing. But then the patient needs, then the whole treatment took around 40 or 45 days. Now actually the patient is a lady. Then what happened is that this lady then after discharge went to the police station and gave a complaint against her husband for getting divorced, and she put the whole thing or the of the hospital admission and all those things in the police case sheet, that she is treated here for this alleged home assault, like that. But actually she has not given the details in the case sheet and all. But problem is that while taking the case, one doctor has mentioned one word trauma in the history, but the whole issue become this word, simple word in the history. Why I am telling this is importance of writing case sheet, because the word trauma changed the whole thing. Because this case sheet is a medico-legal document, and the actually the doctor or the treating department doesn't take much care of this point, one word in the history. But actually she told in a way that the case is taken by the doctor, but she noted it as word trauma, but she used this against the hospital itself, hospital or the doctor. So why I am telling this is, whenever you are writing everything, each and everything in your OP or IP case sheets, it is very important that every word becomes a medico-legal matter when the case becomes a medico-legal. So why I am telling this is that otherwise, if you are in a government institution, you will get support of lot of faculties and all. When you are practicing in a private place or a private practice, you have to take care of these things alone. So that is a very important thing. I just want to mention the importance or the gravity of the each and every word in the case sheet or OP ticket, because whenever, if you sometimes some persons, I have seen prescriptions or medical certificates of doctors who are writing this medical certificate is issued to give in school only, like that they will write in the underside. But actually, even after writing this thing, there is no use, but this can be produced in the court. So these things are very, very important. I told just in the introduction to know the importance of the subject. So I think we can go to the main topic. Hope I am audible. Is there any problem?
No, sir, you're audible.
So the next slide is visible. Is next slide
Yes, sir.
visible?
Yes, sir.
Okay. So the aims of this class, one thing, the most important thing is you can handle the basic medico-legal issues, and most important thing that you can understand whether it is a medico-legal issue or not. Certain things you will not think it as a medico-legal issue, but actually they are medico-legal issues. Then second is conduct of a doctor in courtroom. That is very, very important, because once usually we have a court posting. In a court posting, I have seen a doctor talking. Actually, he talked in between. But in a court, it is a specific rule that you can talk only when the doctor, when the judge asks you. If you disobey or unknowingly also, it is a case of punishment. So it is very important that the second point is conduct of doctor in the courtroom. And third is ethical clinical practice. That is very important. More than the IPCs and all other rules, ethics is important. Ethics, hope you all know, it's the moral principles you should keep when you are practicing medicine. And the next aspect is the basic aspects of negligence and its prevention. Actually, when we are learning or we are practicing on the actually the start of 20 years back, this negligent aspect is not much important in the Ayurvedic thing. But now these nowadays, actually, I think 2 months back one case arisen. I think it is in a private hospital. That is, a patient got burned while doing the kiri, and he has informed, actually he's a foreigner, so he has special considerations. So the doctor is in trouble, and then actually there nothing bad happened, but these things are important. The prevention of negligence and basic of courts and recording evidence, that is also very important, because whenever you have to go to the court, you have to know, because for example you got a summons that is telling that you have to present in court at such and such time, but you cannot go to the court at that time. Then what you have to do, whom you have to contact, and what are the procedures? Because whenever, if you don't know these procedures, you will go to the court and ask some fellow, and sometimes he might be an advocate of the opposite party, that he may tell you some wrong things and all, but the court will look as your syllabus consists of all these things, so you should know all these things. So that is the basics of courts and recording evidence. So we can, these are the aims of the class. And as you know, these are the actually why I am telling this, you know all these things, that is medical jurisprudence, forensic medicine, medical ethics, and medical etiquette. I am not going into the definition or details of each point, but you have to know these main things are comes under the heading medical jurisprudence. So why I am telling this is that when you have some doubts or regarding or these portions, you cannot say hello. Is there any trouble in audio?
No,
Can
sir, you
any?
may proceed.
Okay, I heard some sound. If you have doubts regarding, or if you have some points you have to write in medical legal, or some points you have to note, then it is very important that you have to know where you have to look. So you have to look not in the forensic medicine text. You have to, actually some portions are seen in the forensic medicine text. Actually there are books regarding specifically for medical jurisprudence. And one more thing I have to tell you, those who are interested in this area, there are a lot of medical graduates. Actually Ayurvedic graduates are MBBS graduates are more in this area. There is doctors who are specializing in medical legal area. Actually they are assisting insurance cases, and actually it is a lucrative career option, but you have to know the basics. Actually now I think no need to take LLB at all, but you have to know the basics of medical jurisprudence. Then you can assist in actually this insurance company needs lot of persons like those who know medical jurisprudence all. Actually in Ayurvedic area now cases are slowly increasing. Then these persons, actually they also need doctors for telling these things. So why I'm telling this is the importance of the medical jurisprudence, and you know where to look about the details of these things. And so we will go into the basic definition. I'm not going only on the practical aspect. I'm telling what is a medical legal case. That is, the basic of a medical legal case is a medical case with legal implications for the attending doctor, where the attending doctor, after eliciting history and examining the patient, thinks that some investigation by law agencies is needed. For example, this is a thing happened in a primary health center. A lady came to the doctor and told the doctor she fall from her own scooty, and injury happened. And the doctor actually, as per rule, it is a medical legal case because it is an accident. But doctor thought that, oh, she has fallen from her own scooter. So actually there is no medical legal implication in it. And so he has not written. Actually, there is a register for keeping these medical legal cases. Every hospital has to keep one medical legal register. And in this one thing, I have to make one point. Actually, I have worked in the Indian systems of medicine for more than 7 years. Most of the small dispensaries don't have these registers and all. Why? Because we are not dealing with the medical legal cases. But the problem arises that in an allopathic hospital, what happens is that they are regularly dealing with medical legal cases, and they know they have to make entry in this register. You don't think about register and the procedure and all. At least you have to keep the details of these cases. Otherwise, what happens is that later, actually, what in the previous case, what happened is that this lady hit some another vehicle, and there is an accident, and later police asked this doctor for the injury certificate, but doctor cannot give the injury certificate. Actually, we will deal with the injury certificate later. You have to tell number of injuries, and the biggest problem is that usually our legal procedures is very delayed legal procedure. Actually, when if the case happens today, sometimes you will get summons after 2 or 3 years. The biggest problem is that you may not be working in the same institution, you will be in some other thing, or you have forgotten the whole things. So these things are very important, because even a medical certificate given by you should be kept for at least 3 years in the hospital. But it is, I think it is safe you keep one copy, because usually the copy kept in the hospital and all will not be easily retrievable. That is the most important thing. I think usually if there is slightest doubt, you can take the photo and keep it in your email. Email is a repository. WhatsApp and all are not a repository. So in email it will be there, so you can easily retrieve it. Why? Because I'm telling, because lot of people face problems with the medical certificates, fake medical certificate, false medical certificate. Even you are correct, the patient may be telling you wrong things and getting medical certificate and maybe producing it in the court for extending the case and all. So you have to be very careful while dealing with the medical certificate and all. Slightest, you have to keep every document in with you, and if there is a slightest doubt, you have to take the extra care. So once again, I'm telling a medical case with legal implication for the attending doctor, where the attending doctor, after eliciting history and examining the patient, thinks that some investigation by law agencies is needed. Actually, if a patient is telling you some other reason for his injury, you feel that it is an you have some doubt, then you should enter the details in the medico-legal register, or a register that, and the details of the register should be sent to the police station, or should inform. Actually, in allopathic hospital, it is a daily procedure. Every evening in private hospitals, every evening they will give this book to the police station. But in Ayurvedic hospital, it is a rare case. So you have to take extra precaution. If there is anything, you should know or inform the law agencies. It is your duty bound to do that. And legal cases requiring medical expertise, that is the second thing. Actually, 2 years back, one case of poisoning from the this chemical examiner's lab in the Patur. Actually, head of the chemical examiners in Kerala is in Patur, near near that ophthalmic hospital. And that a case of poisoning, and it was the police assumed that actually the death happened the daughter-in-law of a Vaidya, and he has given some decoction like preparation to her daughter-in-law, but they are unable to find what type of poison is it. So only after finding, only the chemical examiner is finding the nature of poison, then only they can make the thing in the court. Otherwise, it is difficult to prove in the court that it is a legal case. So that is the second thing, legal case requiring medical expertise. And third is any injury or ailment where the responsibility for causation should be fixed by law. That you all know. There is any because injury due to which instrument or and all those things that usually comes in the postmortem and all. Am I clear? Is the things clear to you? Whatever I am talking. Hello.
Yes, sir. Yes, sir.
So a doctor receives a MLC, a medico-legal case, in these three ways. A doctor can receive MLC in the following way. One, patient expressing his intention to register case against accused. This is the most common way. That is, patient is telling, I got an accident, sir, please register a case because I need insurance cover and all. So please register. And second way is, after eliciting history and examination, to label it as MLC. That is, after eliciting history, you feel that there is some doubt. There is even a slightest doubt. Actually, usually what happens in allopathic hospital is that even if you say that, sir, I have fallen from my own home, there is nothing regarding medico-legal and all, but they will note in the medical legal register, especially when you go to the casualty. If you are going to the directly to the consultant, they will not ask these cases, because you can blind them also. You can tell them there is no reason. But problem is that in such a case, if you are not telling the details of your trauma or injury, then he will not be issuing injury certificate. He will be telling to the police that yes, that patient came here for example, the previous case actually we have solved in that way, that the patient came here, he has treated here, but he has not told me any history of assault or injury to me. That is, he has told me that he has fallen in his home. So I have not felt that it is a case of medical legal importance. So I have not checked the number of injuries and all. Why? Because if it is you have understand it is a case of MLC, you have to count the number of injuries and you have to give the injury certificate. Police will ask you in return that you have to give the injury certificate for such a patient. Then if you can tell if he has come in the OP and all, and he has hidden the fact from you, that the fact regarding his trauma, then you can tell the police actually he is not came in the casualty. If he came in the casualty, it is your duty. You have to be extra precautious. But in the case of an OP, you can tell these reasons. Actually, he doesn't tell these reasons. So I have not taken it as a case of MLC. That is why I am telling this, that it is very important, especially when you are practicing alone. So referred MLC cases. Referred MLC case usually, actually I have to see this referred MLC case because I was a doctor in the central prison. In the central prison, you will get referred MLC case because the court will tell you such and such patient or such and here there is mostly convicts. Such and such convicts, you should see such and such convicts, and you have to prescribe treatment. So what I do, I will look, for example, there is a torture by police, case of police torture, and then I have to see a patient in the central prison ward, and he asked the court for, there is an allopathic hospital in our central prison, Pujapara. He asked for Ayurvedic management. Then I looked the patient. Then I have written another letter to the court saying that this patient requires this treatment from the Shalya department because he has got he has no fracture, but he has deep trauma in his muscles and all due to certain type of torture methods. I assume, I cannot say it is a torture, I feel some deep injuries are seen. Whether it is due to torture or not is another case, and it should be inquired with in the presence of both doctor. If it is an Ayurvedic physician also, then he will be also be called for this medical inquiry committee and all. I am not telling much details about that, otherwise because the class will go in along. So in this case, I am telling what importance is that in referred MLKSC case, I referred the case to the college. So actually, I think how many of you know there is a prison or cell in our hospital? Is anybody knowing? Those who are in the Trivandrum College, a cell means for staying these prisoners. Can anybody speak? Prison cell. Do anybody know? Is there our hospital has a prison cell? Previously, now it is not there. Hello. Hello.
Sir, yes, sir.
You know, our hospital has a prison cell. Have you seen it?
Yes, there was once a patient from Pujapura Central Jail.
Okay.
Before 3 months.
Actually, oh, thank you, Arundhati. Actually, earlierly, there is a prison, actually like jail itself. There is a place in our hospital for treating the patients from the central prison. And now it is done in the ward itself. Okay, so I am telling here about this referred MLC cases. So 3 ways you can get a medical legal case. One is patient expressing the case. Second is after eliciting history, you feel that it is a case of MLC. And third is the referred MLC case. In the third case, you should use your wisdom. That is very important. Otherwise, you will be in problem because in our college itself, there is one case actually. Hope you have heard this Suryanelli case. of this torture of a woman. In that case, one of the prisoners or one of the convicts got treatment in our hospital, and later one media, actually I'm not telling the name of the media. In that it came that this patient has bribed the doctors, and that is why he got treatment. He is getting sugar chikitsa and all like that. Certain means news appeared in the newspaper and all. It was a issue. I think it is around 2014. Okay, I'm just telling all these things. Why? Because you will get opportunity to work in all any situations. They are actually in central prison or anywhere, because there are actually they are also planning to get for a permanent Ayurveda doctor from the ISM or like that. So you have to know these basic things, because nowhere this ML medical legal case training for Ayurvedic persons, actually it is told in the syllabus, but we are not getting the proper training. Okay. And next is I am just showing these are the situations you have to remember. That is one trauma that you know. Electrocution is an important thing. If a patient comes with a case of electrocution, in the slightest doubt, you have to keep all these details in the one more thing that is very important. Whenever the patient comes to the first doctor, that who is the person to label it as medical legal case, not the second doctor, because the doctor will the police will ask to the first doctor only. So whenever the patient is attending, he is telling he has he has undergone treatment in the medical college, and he came to you for some recovery of the not so healed injuries from the allopathic treatment, then there is no issue of medical legal case. Medical legal cases arises when the patient first reports to the doctor. The first doctor is the most important person. He has to give the certificate and all, injury certificate and all those things. Or otherwise, there is a second situation. If the patient is expressing that this is a medical legal case, I want the certificate, then also you can give the details, and you have to keep it the case as MLC, and you have to write in the case sheet also this is a MLC case. Okay. And all type of poisoning cases that you can know, and all vehicular factory or other any unnatural accidents. One simple easy way to understand is any unnatural accidents or any accidents. And then sexual offense. Sexual offense, one thing you have to be very careful. If you are examining a girl or a woman, then you feel something doubtful, then you have to tell them, and you have to include there is a slightest doubt, then you have to make it as an MLC. Otherwise no issue, but usually those type of cases are not coming to our hospital. So but you have to know these things, otherwise sometimes there will be a problem. Cases requiring age estimation, unconscious cases, unknown cases, hanging, drowning. I'm not telling, you can actually read by yourself itself. I can share the PowerPoint also, there is no problem. Brought by the police and sent by the court, unnatural death, and all cases where patient or relative, that is very important. All cases where patient or relative request, and any other case with legal implication. Next is procedure for registering an MLC. The first point is very important. Responsibility of labeling lies in the doctor, because you have to, the treating doctor is the person to determine whether this is a medical legal or not. Patient can tell, then the doctor, then also the doctor is the labeling authority. And as per Supreme Court, anything, the most important thing is first save life, and then all other things is secondary. Identify whether it has MLC or not. If it is, register it and inform police. And medical legal register in duplicate or triplicate. As actually in small dispensaries and all, there will be no medical legal register, so you can write in the paper, and you can actually, there is a format. If even if proper format is not followed, then also you have to keep all the details, then you will be safe as early as possible and avoid delays, but can be registered at any time. That also very important. That is a point. Many patients or many fake cases uses this point, because medical legal case can be registered at any time. And these are the basic procedures. Just first is identification, registration, and reporting to the police station. You have to give a final opinion, case examined opinion, investigation and treatment, and preparation of records. This is the basic thing you have to know about the MLC case. Common medical legal problems are injured patients, cases of alcoholic intoxication and poisoning, snake and insect bite cases, dead on arrival or brought dead to the hospital, unexpected death, victims of sexual offense. These last two are not so common in our hospitals, but it can happen. And points to be remembered: you cannot refuse to examine MLC. That is very important, because a case happened in a private hospital. He told, I will not look because this is a medical legal case, you should go to some government hospitals, like that. But you cannot say that, it is a rule. Earlier you cannot, you can easily send him to a government institution, but you nowadays you cannot refuse. You can tell him cordially, it is better to go there if you are in a private institution and you don't have the necessary facilities, but you cannot refuse. That is very important. Never delay examination and intimation to the police. Prepare medical certificates in time. Always obtain informed consent. That is very, very important in all these cases. If the patient refuses for something, you have to write it in the OP or IP. That is very important. Why? Because in the negligence part, I will say, because if a patient is telling that he doesn't need such a treatment, or he doesn't need one type of treatment, for example, he doesn't need this Vasti and all, he is telling, I don't need Vasti treatment, Kashaya Vasti treatment, and you feel that this patient, if he receives this treatment, it will be much better, then you have to, these are all rules, but you can see a lot of cases where rules are not followed. But if you have to remember that, as per rule, what you have to do is that you have to write it in the case sheet, that I told the importance of Vasti in this disease, but the patient is, refused, or patient is not willing to take. So that is called informed refusal. Actually, this is very important in the allopathic. If the patient goes, if a patient needs surgery and patient is not willing for surgery and it will cause him harm, then the doctor will write in the side of the case sheet and OP ticket itself, patient is not willing for the treatment, so he is safe. This is actually, it is a type of defensive medicine. It is not good, but it is needed, because for the safeguarding ourselves. And if death is inevitable, arrange to take dying declaration. In case of death, don't issue death certificate. We will deal in the next. Injured patient acts. I am not going to tell each and every slide in detail due to actually I think we have 15 minutes of this discussion time. I will you can ask doubts because all slides sometimes it will be boring. So there is injury and wound report. That is very important. Report details of the injuries found in the accident register, come injury or wound. There is actually in our hospital itself there is an accident register or injury or wound report. This is very important because actually in the previous case I told, in our hospital itself, the police has asked our doctor to give the wound report or injury certificate. The original to be issued to the police officer and copy with the medical officer. Should give necessary first aid. That is very, very important. Even if you cannot manage this case, if the patient has come to you first, you have to give the first aid. Otherwise, if the patient, sometimes you don't have the necessary facilities, but then also it is the responsibility, because if you are in a casualty, it is the responsibility of you to give the basic first aid, or in whatever you have trained with whatever available facilities. Otherwise, something untoward happens, you will also be a responsibility. It is also will be your responsibility. Okay. And death in wards. So in the death certificate, actually, Dr. Hridya told me to give some details about the death certificate and all these things. I have not included the immediate signs of the death, but I will tell. Actually, whenever actually there are a lot of doubts. Yesterday also I got a call from one of my first PG students, 2008 batch PG student. He called me. I will tell the issue itself. He called me. He actually he was living in Ernakulam, and one of his relatives called him for confirming death. And he went to the home. Actually, he went to the home and he confirmed death by actually he confirmed death. And I will tell what are the things you need for death confirmation. Actually, death confirmation is done by the immediate signs of the death. immediate signs of the death. Actually, you might have learned a lot of tests in your forensic test. This diaphanous test, that is keeping torch under your fingers, like that, Winslow test, mirror test. Actually, these tests are of only historic importance, nothing useful in so whatever useful in the present practical scenario is, whatever is that, one thing is that first thing, you can touch the patient, so the temperature difference you can know. Okay, the body will be usually slightly cold, but if it is a death, immediate death, body will not be cold, especially death in the ward, the body will not be cold. So the first thing you can look, that is, one, you can look in the eyes, you can show light or torch light in the eyes. So the most important thing is pupil is dilated and fixed in a death case. That's a very important sign, very easy to identify. Pupil is dilated and fixed. Dilation can happen if you apply some medicine, but it will not be fixed. Hope you know pupil, cornea, iris and all, that you have to know. Otherwise, you cannot deal this in an this type of situation or a tense situation. So the most important thing, and one of the easy things you can is that pupil should be dilated and fixed. Then you have to check for respiratory signs. Respiratory signs, you can keep your stethoscope in the hope you know how to elicit the breath sounds. That trachea part, you can actually more breath sounds, or easily you can these are all practical tips, not from the text. You can hear the breath sounds more clearly in that area. You can check for breath sounds. And then next is the test for circulation. That is, one is you can know, you can check pulse, because one thing is that when you are tense or you are eliciting the pulse by pressing the finger deep, you can feel your own pulse. So be calm and then do. So the third thing is pulse. You can feel all type of radial pulse, jugular pulse, pulse in the neck region, and all pulse you can check that. Then you can auscultate, especially in the precordial area. Hope you know the areas where you have to auscultate. So and then you can check for reflexes. Reflexes will not be elicited in a and even all these things, there will be confusion cases. In confusion cases, you can tell the patient if the, because there are cases of trance cases, because actually the patient has some fits, and or because I have once seen a patient, he has undergone a fits just before his death. Because so we will be in a confusion. Then you can tell the patient there is a slightest amount of doubt. Sometimes if the hospital, if a hospital having defibrillator facility and all, they can sometimes revive the patient. So then you can tell the patient or their bystanders. So the immediate signs of death or those things you can test is that you can test the you can give torchlight in the eyes and make sure pupils are dilated and fixed. That is one thing. Second thing, the examination of respiration by hearing the breath sounds. Then auscultate, you can auscultate and feel the pulse. You can feel the temperature of the body, and these are the, you can check the BP and all. These are the basic things. Actually, is this enough, or I have to discuss more about this, or we will go for this confirming death and other details? Can anyone speak? Hello.
Yes, sir. This is understandable. Thank you, sir. You can proceed.
Oh, so I think it is now 9:70. Okay, we will go a little fast. Okay. So 1 second. So these are the basic things you have to remember about the death confirmation. And whenever you, the another point is that I am telling the case of my friend, not friend, he's a PG student, but more like a friend. He used to call and what happens is that he has given confirmed death, and later that patient has called him and asked for a death certificate, because he want to send this death certificate to abroad for coming for his, actually the patient's some relatives are outside, so he has to come, he need a death certificate. But death certificate should be issued only if you know the cause of death. Otherwise, you don't give death certificate. If the death happens in our hospital or in your hospital, you can give death certificate and you are responsible to give the death certificate. But if it is happening in some home around you or your relatives, etc., don't give death certificate, because you don't know the cause. Sometimes why lot of issues arises. Because what happens is that so actually I have when I am working in Kasargod, a patient that what happened is that actually she was a bedridden patient for 12 years. Her husband itself poured some poison to her mouth, and the patient died. Unfortunately, the doctor in that near to her home given this death certificate, and he become a part of the crime. That is the biggest problem in that. Actually, what happens is that in the court he will be given as a person who supported to help the culprit to escape by if you go he got the death certificate, the dead body can be burned, then all the proofs are destroyed. So very careful while giving death certificates. In the hospital you can give death certificate if you have no doubts. If there is any foul play doubt, you don't give death certificate. You have to inform the police. The police will give the permission to the hospital for giving means for the postmortem and all other procedures. Even actually it is a rule, even if you are taking one patient from your home to hospital and the patient died in between and then he reached the hospital as dead, then if it the hospital will keep the dead body and will give to you only after the police investigation. So that is very, very important. You can go and confirm death, but don't give death certificate. Otherwise, you should be 100% sure. That will be very difficult. Or other it is sometimes if you are relative and you know the patient and all those things, you can give. There is no issue. Okay. Otherwise, what is the rule is that that rule also you should know. What is the rule? The rule is that they should tell the nearest PHC, primary health center. The doctor or the health inspector will come and inquire, and they will issue the death certificate. Don't be in trouble. Very, very important. Extra important point. All other points can be learned in the text, but this point is not. Actually, this is the area where we get lot of calls, because lot of people will, can we give the death certificate? Is there any problem like that? Okay. So this is the form of the death certificate. In that you can see there will be an immediate cause, antecedent cause, and a contributory cause. Immediate cause, for example, is myocardial infarction. Antecedent cause, maybe he is having the circulatory disease or coronary artery disease. Contributory cause may be diabetes and all. And I am not going to explain all these things. These you all know in the in the forensic medicine itself. In the third year itself, you have studied. Okay. And then dead on arrival, that we have discussed, brought dead to the hospital. Person brought dead on arrival to the casualty. Person dying after admission and before making a diagnosis. In all these cases, you don't certify death. That is very, very important. Dying declaration, I am not going in the details. Only thing is that if there is a less chances Ayurvedic faculties are facing this type of situation. If there is such a situation, then what you have to do is that you can write whatever the patient tells. It is very calling magistrate and all you will not get the sufficient time usually. Okay. Victims of sexual offense, that is very, very important. Especially children may be coming to you for treatment and you may be identifying there will be some sexual assault. Bigger people, they will tell you. Small children will come to you for treatment of some other case. I also got a case when I have started practice. I don't know what to do and all those things. Actually, I have called all my seniors, doctors, etc. What I have to write, what I have to tell. Fortunately, that they have gone to general hospital after that, and they have taken all the details. So you have to be very careful while examining the children. Whenever there is a doubt, you have to do all these things. And then cases of poisoning, I am not going to the details. Assist the police in determination of manner of death, intimation of police, all these things we have told. Law in relation to justice, I am not going to. These things you have to know. because whatever the things, if you have any doubt, you can look the criminal procedure code. This is available in the internet, the book itself. Wherever there is a doubt, you can look, because sometimes the patient can also give a case against you. So you should know where these things, what is postco, etc. That things you have to know. And I'm not going to details of this. You just these important sections also you should know. I'm not going to explain. And the courts you should know, because whenever you get a letter from the court, you should know what is usually in the court letter. It will be written as CJM court. That is Chief Judicial Magistrate Court. I got familiar with these names of the court not from our text. Actually, when I worked in the central prison, what happened is that their case like CJM, this is a case from CJM, Chief Judicial Magistrate, like that, first class judicial magistrate, etc. Sometimes you will get summons from these courts for as an expert witness or as a common witness. So then you have to know what type of court, fast track courts, all the names of the court you have to know. I'm not going to explain each and everything, it will be boring. So doctor in court, documents of medicolegal, these are the documents. Wound certificate that we have to give, you have to remember. If you need, I will share the this details of the format of the wound certificate. Actually, it is available in the Google. Medical and sick leave certificate. Whenever you give medical certificate, it is very important. You should write all the details correctly, and diagnosis should be made in our language. That is, for example, Kadigraham, Sitmam, Ega Kushtam. Never diagnose in allopathic terms. Why? Because there is a big issue. If the case comes to the court, if the diagnosis is made in the allopathic name, they can even call an allopathic doctor in the medical committee. That will be a big trouble for us. So always diagnose in our terms. If you can write Kadigraham, sometimes they will ask for the explanation of Kadigraham. Then whatever, you don't need to write it is IVDP and all. You can write the symptoms. That is whatever told in the patient telling you, and whatever details of the Kadigram you can write. Maximum you can write this disease have correlation with such and such disease, that you can. That also in a safe practice in defensive medicine, you don't need to write that also. You only write our diagnosis, and if they ask for explanation, give the explanation or the symptoms told by the patient. Fitness certificate, that is very important. Actually, I have got 2 or 3 calls from this our colleagues regarding they have given fitness certificate in advance, because patient will tell that, okay sir, after 1 week rest I will go to the office on the next 30th. So can you give the certificate of May 30 today? Never give fitness certificate in advance, because sometimes in between something happened to the patient, you are given the fitness certificate already for a future fitness certificate. Never do that. Okay, court attendance exemption certificate, that is also very important. Patient will use your medical certificate as a court attendance exemption certificate. That we have to be very sure, because some patient, they will, what they will do, they will come to you and say they have low backache, and then you will be giving certificate, and then they will be producing, their advocate will be producing this certificate in the court and telling that my patient is having such a low back. He may be producing the 6th medical certificate in the court from different doctors. Unfortunately, the court will call sometimes the 6th doctor for why you have given, and he will be going through all the possible consequences. Dying declaration, we have already told. Mental illness certificate is not required here. And doctor in the courtroom, that I already told. These are the steps of recording evidence. This you have to know the basics. Actually, oath, you have to take an oath, and you have the direct examination, means the advocate will explain to you the case. Usually in a government cases, I actually gone for one case regarding one KSRTC bus accident. Then the public prosecutor will be the part from the government, and he will be explaining all these things. And then the cross examination part, you have to remember, that is the difficult part. You can actually in the court posting, you can see certain doctors are cross-examined in such a way that even we feel ridiculed, because the opposite advocate will go to some other doctor and will ask points, and then he will be cross-examining this doctor. And usually this comes when in cases of usually murder and all big cases. Usually in the other cases it will be less. And actually there is a priority for doctor. If you are telling you are a doctor, your case will be called early. You can inform the judge through the Shirastha. I'm not going to details. Actually, we have now, I think, 2 minutes left. Conduct of doctor in the court. Always go in the court in a well-dressed manner and ask whatever asked by the court, and tell in a very bold and clear manner, not be arrogant. And that is very, very important. Whatever you tell, if you don't know something, you are not supposed to know everything. If you don't know anything, sir, I will refer and tell immediately, I don't know the answer. That you should be very crystal clear in whatever you say. And next, doctor and ethical clinical practice, that you all know. I am not going to the ethics and all. Consent is very important. Whenever there is, the patient is not giving consent, you have to remember that you cannot examine the patient. And whenever you are examining, especially the male doctors, whenever you are examining a female patient, always keep a female staff with you. Otherwise, what happens, earlier it is said that the patient bystander is also okay, but sometimes the patient bystander can turn against us, and then they will tell, okay, doctor has done such and such thing. So always keep a female attendant, not female staff of the hospital, so you will be safe. Lot of issues are coming today, that is why. And the medical negligence, I am not going in the definitions of this medical negligence. Actually, civil, criminal, and contributory negligence you have to know. That is, civil negligence you can know. Actually, civil negligence you should know, because in the consumer forum also now patients can give case telling that this doctor has treated me for 3 months for the low backache, and I have the low backache has not reduced also. Then I go to another doctor and he treated me within 1 month. He can give case, because now patient is a consumer. As per, actually 2 days back the final clarification came. So this our profession, earlier it was not a consumer, now it is a purely consumer. Patient can give case against, but all comes under civil negligence. Criminal negligence means anything, because if a burn issue while doing kiri, all things will come under the criminal. Contributory negligence, because for example a bystander or a but not a bystander, a therapist issue partly lies in the responsibility lies in the doctor also. Even the lab result part responsibility lies in the doctor. Okay, 9:30 I will go. Prevention against negligence: do not criticize another doctor. Qualify staff, never employ unemployed. Actually, there is a case arised because he kept the person who is in the medical shop for doing kiri with him, and some problem happened to the patient, and he given case, and the case, because he has kept the unqualified staff. That is very important. Complete records, that is very, very important. Valid consent, and this point is very important. Establish good professional relationship. That is against with this one point you can guard against almost all things. Good professional relationship. Conclusion. So common medical legal cases, doctor in court, and ethical practice. I think that this point is very important. Ignorance of law excuses no man. Not that all men know the law, but because it is an excuse, every man can plead. No one can refute him. In simple words, anyone can tell, sir, I don't know the law. Then you don't do the practice. For example, if you're telling the police, I don't know, sir, by seeing the red signal, I should stop the vehicle. You cannot say that. So ignorance of law is no excuse. You should know, you must know. So thank you. Any doubts you can ask. Sir, Hridya, it's over to you. Hello.
Yes, sir. Yes, sir. Thank you
Any
so much,
doubt?
sir, for such an enlightening class. It was, I think, much needed yet lesser known facts, which all of us should actually know. All delegates can post your queries in the chat box. We shall discuss them. We have a few queries right now. So the first doubt is, in case of accident or sexual offense, sexual assault cases and all, should we give Ayurvedic diagnosis itself, as in case of wound and injuries? Should we use kshadam, vranam, such terms, or Should we give
Yes, it is
more than
always
terminologies?
you have to give abhighadaja vigaram. Actually, it is not a precise diagnosis, but you have to name it that, and you can tell the details of the things in the below terms. You can tell, okay, this type of injuries, etc. Injury, you can write injury itself, laceration, etc. All those terms can use, but the diagnosis is important. And sexual offense is not a diagnosis, or rape is not a diagnosis. It is a legal state. Hope I am clear. Is there any doubt you can ask in this area also?
Okay, sir. Thank you. So the next query is, what all are the precautions and the legal aspects related to preparation of medicines and sale of medicines, Ayurvedic medicines?
Actually, it is as per rule, Ayurveda doctors can prepare medicines for their patients, not for regular selling. You can make medicines and give it to your patients. That is to your patients. If you are selling as actually those who are coming to you and you are selling from as a over-the-counter selling is not allowed. I think I am clear. The point is that you can prepare medicine. For example, you are practicing in a remote village. I have also done. Then it is easier and economical that you can prepare kashayam and you can give to the patients coming to you. But if you are selling the kashayam over the counter for another prescription, for the prescription coming there from another doctor, then it is a different issue. Then you have to follow all the rules. And whenever you are doing making preparations of arishta and etc., you have to take certain licenses regarding that. That will be a big topic. I am not going deep into that.
Thank you, sir.
I
We can
think
wait for a few minutes. Yes, sir. Yes.
Krishnan, Ayurveda doctors medicine self-I undaki kodukka. Okay, I have told.
Yes, sir. Are there any other queries?
Actually, the important thing is that the query arises when we are in trouble or when we need some help. You can call me. I will answer you, or I will tell you whenever you need some situation, because usually lot of calls you will be getting in this. Most area is this death certification, death confirmation, regarding the certificates, medical certificate. These are the areas usually doubt arises. So whenever there is a doubt, you can ask. There is no issues. I'm happy to tell because I am also learning from that.
Sir, we have one query now. What are the formalities for establishing a medical store?
What are the formalities?
Before establishing a medical store.
Oh, actually, before exam, actually, it is not directly. You have to take the permission from the panchayat or the corporation wherever you are establishing a medical shop. And if you are practicing, then also you have to take license of the clinic and all those things. In medical shop, you can the license of clinic is not needed. But if it is establishing it as a clinic, you have to do all these things.
Okay, sir. Thank you. Are there any other queries? You can either unmute your mics or post in the chat box.
What is Asimov Donier? What is the role of Ayush doctors? Actually, where it has gone. Okay, one second. Now, what is the role of Ayush doctors who will not allow to share of patients' medical secrecy with Supreme or Constitutional Court or with government administration because of physician not able to obtain permission from his or her patient due to medical confidentiality within line of deontology. Medical, that word I don't understand. I think the question is that sharing of patients medical one thing I can Donier, if you have any doubt you can ask. From the question I understood that actually any details, if it is needed by the state, you have to share it. There is a rule regarding professional secrecy. You can reveal it only with the consent of the patient. But in the case of a state means usually in a criminal case, state is the other party. In such type of cases, you have to reveal as per a rule because it is in the greater interest of the citizens. Other cases, you can delay revealing those things, telling the rule of professional secrecy. Hope I am clear. If there is any doubt, you can ask.
Thank you, sir. So we have one query. What are the risks associated with prescription of allopathic medicines by Ayurveda doctors?
One second. Okay. What are the risks of prescribing allopathic medicines that you are asking?
Yes, sir. Yes, sir.
Okay. So actually, that is a big issue. One thing is that actually there are certain rules telling you can prescribe emergency medicines during for a patient if it is that much required. Regular prescription of allopathic medicine is not allowed, and it is a crime as per a rule. Different states has different rule. Regular prescription. But if you can, as per rule, you can prescribe allopathic medicines in emergency, and there is a list of medicines they have told for giving in emergency and all. But the issue is that in that situation itself, you have to prove that there is no time to refer this patient to the nearest center where allopathic facilities available. If you are practicing in such a place that it is very interior and the patient has to reach in such a place within such a short time, then you can obviously, for saving the life, you can prescribe allopathic medicines. Otherwise, as per rule, you cannot prescribe the allopathic medicine. And most of the cases in our hospital also, we are prescribing a lot of certain medicines for Shara Sutra and all, because we have an allopathic doctor. Otherwise, you are not allowed to prescribe. The rule is that, but rule differs from states. Actually, in Maharashtra and all, you can prescribe. There is no issues. You can do postmortem. You can do all. That is why postmortem is included. That this much detail in the syllabus and all those things, because central government has given permission. But the state government has to, because health is a point done means guaranteed, governed by rules of both central and state. I'm not going into the constitutional details. That is certain things, education, such things are governed by both central and state rules. So health is a thing governed by both. So whenever, even if the central government has given the permission, the state government has to ratify according to the situations in our state. But in our state, the thing is that very allopathic practitioners are available in every nook and corner. So I think I am clear in that question. What to do about an Ayurvedic B certificate physician who's selling Arishta and Asa for alcoholic people for making money? Okay, he is asking. Sorry, I have read it. It is. I will reply privately. Fitness certificate. Fitness certificate കൊടുക്കുന്നതിന് കൂടുതലായി എന്തെങ്കിലും ശ്രദ്ധിക്കാനുണ്ടോ? Actually, for giving fitness certificate, you have to remember basic things. You have to be more careful while giving medical certificate. While giving fitness certificate, you have to check the form. In the form, if it is a fitness certificate for vehicle driving, then you have to check the eye test. Whatever it is told in that, you have to know about. One example I will tell. 2 days back, one student from NCC came for the fitness certificate for a high altitude trekking. Then I told, it is in the certificate, it is told that as per annexure B, this such and such person, such and such student is fit for this type of exercise, like that. But I don't know the annexure B told in the NCC. I told the student, I know you. Actually, she is one of my relatives also. I told her, I know you, but I don't know this annexure, so you better bring that annexure. I will read that and then I will give the certificate. She sent me the thing and then I have given the certificate. So that thing you have to remember.
Thank you, sir. Hope the query was clear. So we have another doubt. How should we deal with the sale of Ayurvedic medicines with religious vows and mantras, that is by unqualified practitioners?
Yes, actually, in that the thing that you have to inform, actually, the easiest way you can inform the nearest our AMI. There is a cell dealing with these things. You have, but with proof, that is very difficult to get specific proof. No one will be telling. Actually, I know lot of means these religious person using our medicines very commonly. But problem is that if you have the proof and the person is willing to tell that I have taken this for this from such a person, then you can inform the cell of our AMI, or you can directly inform. As per rule, you have to inform our Travancore Cochin Medical Council. Then they will take case against this person for the unauthorized practice or Vyaja Vaidyan, like that.
Thank you, sir.
Okay.
If there are any other queries, kindly post them soon.
And obviously police also you can tell these things, but usually it is very difficult. They will take case against such cases. They will be usually inquiry.
Okay, sir. I think we have come to the end of the queries. I now call upon Hiba.
Okay.
Good evening, everyone. It's an honor for me to have the opportunity to thank you all dignitaries on behalf of HSA 2021-22. I would like to express my gratitude to all the esteemed delegates for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Chief Guest, Dr. Prasanth Sir, Associate Professor of Department of Agatha Tandra, Government Ayurveda College, Trivandrum, for taking out time from his busy schedule to grace the event. Thank you for inspiring and encouraging us with your extensive knowledge, sir. A special thanks to Dr. J, Principal of Government Ayurveda College, Trivandrum, for providing immense support to make this webinar happen. I must thank the organizing team of VEEKSHA academic series for their sincere effort in conducting a series that will deepen our clinical knowledge. Thanking all the attendees of this meeting for their active participation. Once again, thank you everyone for making this session of VEEKSHA academic series a successful one. Thank you, everyone.
Thanks, dears. Any doubt you can ask, or anything you can ask. My phone number is available with the organizers. You can ask. Thank you. Thank you all. So can I leave, Hridya?
Yes, sir. Thank you once again for such an interesting session, and thanks to all the participants for the patient listening and the active discussion. It was very informative, sir.
Okay,
You
okay,
can tune into our Facebook and Instagram pages for update of more classes, and the recording will be uploaded in our YouTube channel, HSA 2021-22 GABC. Thank you, sir. Good night.
good night.